Hey, thanks. It's been an honor to let me come and talk to you. We've had an incredible last year, a lot of hardship for so many individuals, especially a lot of our folks who are on the front lines that don't always have the ability to telehealth, concerned about being evicted from their housing. I can't tell you, I've helped mothers with children living in their cars, trying to function and trying to find resources. So we've seen an enormous amount of increase in homeless, and the predominant racial ethnic population are African Americans, making up a significant number of those cases. So what I want to do is talk about vaccine safety, because that's on everybody's attention. And the health department is going to be kicking off the vaccinations from our health department on Monday. So I want to just tell you a little bit about that. And hey, Crystal, will I have 15 minutes?
Yes, you do.
Yes, okay, yes, sorry. Okay. So I'll go fast. Now, okay. Everybody hears about this Tuskegee syphilis. So I want to explain to you what that was. So back in Tuskegee, 600 Black men, this was in 1932. And the study went to 1972, that's real clear, where we were having a huge epidemic of syphilis during that time. And medical care professionals wanted to know, well, what happens if you never get treated for syphilis? And in 1932, we were treating syphilis with mercury and arsenic. And it only cured 30% of the people with syphilis, and a number of them died as a result of the treatment. And so they said, we're going to see the study and see what happens, what's the long-term damage. But in 1945, penicillin came around. And they said, wow, can you believe this? Penicillin cures syphilis. And so they started treating people with syphilis in 1946. But guess what? They said and told those Black men, you'd already been getting treated for syphilis, and they did not treat them until 1972, when someone had an outcry, found out about this, a new physician in a community, and realized that all that needless pain and suffering, because the syphilis got transmitted to their significant others, their wives, and they had a lot of congenital babies. These babies were born with facial deformities, brain damage, and other things and other items. Now, pictures of this where they thought they were being treated for syphilis. So long lines of these 600 men. But this changed the whole history in this country in terms of research. Now you can't do research unless it is approved by a special board of experts that will allow this to happen. It's called internal review boards. And so even our health department has a research committee. And so all academic centers and other locations, okay? Ed Kennedy, the baby, was the first one that passed the legislation back in the 70s to make this occur for anybody doing any research in the future. Now, let me also talk about this new vaccines. There are two of them. They're on a new technology platform. So these are the type of vaccines that have never been produced with this technology. I want you to look at that young lady there in this picture. That is Dr. Corbett. Dr. Corbett is the #1 scientist in Anthony Fauci's lab that led to the development of this vaccine for the Moderna vaccine, okay? This is a brilliant, sharp lady, smart as heck, got her PhD, and you know when you have a woman and even a person of color, you're lead medical scientist, you know the lady is bad, right? Okay, so look at that name, all right? Next slide. Now, next slide if I could. Oh, I guess that's me. Let me see what's happening here. I think, oh, there we go. That's the first person that's received the first COVID-19 vaccine in the country. okay, people of color. But how does the vaccine work? Okay, messenger RNA is part of everybody's body cell. Okay, it helps to produce other cells. It's like it comes from the center of your cell. We call it the DNA, and it sends messages out, and it helps to build other cells in our body. And these special proteins on this vaccine is a particle of the virus, but it is not live. It is a man-made component made identical, because we have the genetics code now, the virus, that we made a man-made spike protein just like this, which allows the virus to attach to the cell and replicate. And so in the vaccine, we inject this vaccine with this messenger RNA. It's man-made, okay, but it ain't the real virus. And it goes into our cells to produce all these spike proteins. Now, what happens is your immune system doesn't recognize these proteins now introduced by this vaccine. And it starts attacking these proteins and say, oh, I've got to build up antibodies now to fight off against this infection. And the vaccine is sort of like a fake coronavirus. So now I have built up all of these antibodies in my system. So when the real coronavirus is exposed to you, you now have a significant amount of these antibodies already built up in your system to prevent that virus from entering into any of your body cells. This is no live virus. There's no way it cannot cause COVID-19. Now, you will have side effects. Of course you will, because this is a battle. And so it's your antibodies fighting against the real virus infection. So you may be tired, you may have fever, achiness, because your body's experiencing an immune response. But in your core body cells, you have what's called DNA. It's your genetic makeup. It makes who you are, what you look like, and your characteristics. This messenger RNA only enters into the cytoplasm of your body cell. It's like an egg yolk, where the egg yolk is yellow and inside and the white is the cytoplasm, but it never reaches your DNA, so it cannot alter your genes in any kind of way. Now get down to the vaccine. Moderna is one of them. All of these vaccines are 2 dosages. This one is separated by 28 days. You have to be 18 years of age of older, and you get it in your deltoid muscle in your shoulder. And you have to be 18. Fiser, on the other hand, it can go down as low as 16 years of age, but it requires a special type of storage freezer. It has to be minus 98 Fahrenheit degrees. And so even local health departments don't have that type of storage unit. Only hospital systems, maybe big labs like Roche or Lilly have these type of storage things for the Fiser drugs. So you won't see this particular vaccine in regular doctors' offices eventually. You won't see it unless they're able to stabilize this vaccine. But what's the side effects? 70% complain of fatigue. 63% will have a headache. You get body aches. 40% chills. Fever, 15% with Moderna, but 3 of them have had what's called Bell's palsy. This is where you have a paralysis of the nerve in your face, and because of that, one side of your face will droop, and it looks like you've had a stroke, okay? Now, we don't see this in higher numbers than what we see in the general population, but it can occur, and that Bell's palsy can last months to over a year. And there's some people, because of cosmetic reasons, have had facial feelers get a allergic reaction, localized swelling around those areas where you have facial feelers. Now, children and adolescents cannot get this vaccine because we haven't finished clinical trials related to that. We do have a children's trial going on. I think it goes down to age 8 to 16, but it's still going on. We don't have the results yet. So Fiser, both of them have soreness at the site of injection. Similar, fatigue, headache, muscle pain, joint pain, chills. They had 4 Bell's palsy in this patient, but this is what should get your attention. 8 of them, and this number has grown now. It's now up to 20 patients that have had an anaphylactic reaction related to Fiser. Every single one, with the exception of one, have had severe allergies, have had episodes of anaphylactic reactions. And so before we thought it was just only related to this product in the vaccine that helps to stabilize the vaccine so it can last a long time. It's called polyethylene glycol. We thought that was the only thing we had to worry about. But if you have an anaphylactic reaction to anything, shellfish, peanuts, what other things do people get severe, a bee sting or whatever, and it's an anaphylactic reaction, I would not take the vaccine related to this. But if you're in a good hospital setting or a health department or whatever, people who are trained to handle this, we have a remedy. It's an injection called epinephrine. You get it, but you have to get it in a timely fashion. You have to get it within 15 minutes. Usually your reaction will go away. I think of the 20 people that had an anaphylactic reaction, only one had to be hospitalized for about 36 hours. Now, so bees, peanuts, if you've ever had a severe allergy, you got to stay around 30 minutes for observation. But if you've never had any allergy or anything, just stand around for 15 minutes and you should be good. So I'm just about to end here. 1 second. Safety, 95% effective. Now, are there enough people of color in these trials? So we know that in the Fiser, they had 44,000, and at least 13% in that trial was Hispanic, 10% were African American, 6% were Asians, and 1% Native Americans. And we made sure that the older age groups, nearly almost half of them were 56 or older. For the Moderna, a little less enrolled of about 30,000, but still 20% of the participants were Hispanic, 10% were African Americans, 4% were Asians, and 64% of these people received a trial of 45 and older. 39% were 45 to 64, 25% were 65 plus. I am on the National Medical Association, the oldest and Black physician group in the country since 1895. I'm on their NMA task force. We have our task force of 10 members, have talked with both of these companies, Moderna 4 times, Fiser at least 4 times. We actually talked with the FDA director ourselves, and we've talked with AstraZeneca, I believe, 2 or 3 times, and we're scheduled to talk with Johnson & Johnson actually tomorrow. But why should you get this vaccine? Okay, this is the problem. This is the concern. You get long-term effects if you have the actual COVID infection. So there's about a 5 to 10% of you will develop what's called chronic fatigue syndrome. This means every day you wake up and you get up, you are exhausted, you're tired. You don't have to do any exercise related to this. It's just that if you've ever had mononucleosis, you may have an understanding what this sensation is like. Some people, because the infection can cause damage to your lungs, you may have and be left with some shortness of breath that's chronic. You may have a persistent dry cough. Or your muscles or joints are aching all the time, and some experience chest pain. But you can also, because COVID-19 is associated with development of blood clots in your body, you could develop a stroke, you could have seizures, and you can have something called Guillain-Barré. It's a neurological condition that is associated with temporarily temporary paralysis, meaning you can't walk temporarily. That may last for months. And then it's the lasting damage to your heart, that you're young, you may have this inflammation of your heart, but it may lead to early development of heart failure. Muscle pains, it causes brain damage. Some people have had persistent headaches daily for at least 3 to 4 months. Or you're experiencing various episodes all the time of fast and pounding heartbeats. And then a number of you know about the loss of smell or taste that can be persistent for months. But the thing that really bothers people is called that brain fog. You have memory problems. You can't concentrate and you can't sleep, difficulty sleeping. And men, I know you don't have any concern about this, but ladies, you can't have hair loss as a result of having experienced COVID-19 infection. But have you ever been in the hospital, been on a respirator, intubated for weeks? So you can, as a result of that experience, feel a post-traumatic stress syndrome-like syndrome. You know, that stress, that trigger, it can lead to depression and anxiety. The 2 vaccines on the horizon, AstraZeneca is going to bring their vaccine up for approval in April, Johnson & Johnson 2021. Now, who's eligible for the vaccine currently right now? So kicking off on Monday at our health department, we're going to be open Monday, Wednesday, and Friday from 8 to 5, Tuesday and Thursday from 10 to 7 p.m., and Saturday from 9 to 1 p.m. No cost to this vaccine. Hey, if you got a copay with your insurance, you're not supposed to pay that either. So that's on your insurance to pay. But we do need you to get eventually the second dose in order to increase your efficacy. But right now, for phase 1, we're only looking at essential healthcare workers. That's phase 1A, which we're currently in now. Essential healthcare workers and first responders. And Governor and Dr. Botts announced yesterday that we are now adding also people who are age 80 and older. So those are the 3 currently that is eligible to get vaccinated now. And those first responders are law enforcement, firefighters, and also it could be clergy. It can be considered essential healthcare workers, those who will go into the hospital and visit patients. So you're essentially like a healthcare worker. And so those are currently who we're looking at right now. But we're also, once we get through all the 80 years of older, and why are we starting out with that age? Because they're the ones with the highest risk for hospitalizations and death. At the beginning of this epidemic, they made over 60. If you were 60 and over, you made over 40% of our cases. In December now, seniors are making about 20% of our cases. So those are our first line of workers. Now, eventually, we hope to be finished with all of them definitely by the end of January. And then we're going to move into phase 1B. So these are some of the individuals we're looking at. Instead of the 75 years and older, that will drop to 70 and older. In our phase 1B, we'll be looking at correction officers, people like grocery store workers, bus drivers, teachers, and support staff members, child care workers, and U.S. Postal Service workers. But there may be a little change and adjustment in this. For example, depending on how much vaccine availability we have. So if we get tons of the vaccine where we can handle everybody here, fine. But if they say, wow, we don't have enough vaccine to give everybody here, then we will look at, hey, if you're a teacher, I need to vaccinate those 70 and older. So if you're in your 20s and 30s and I know you rarely get hospitalized and you're not dying, I've got to take care of the people who are at the highest risk first, has the highest rate of hospitalization and the highest ability for death, then that's who I need to consider. And then going to the next phase 1B. Well, I guess I'm stuck, so sorry about that. Oh, there we go. Then it will be people 16 to 64 who have high-risk medical conditions, and it'll be people age 60 and younger. Now, I'm sorry I haven't changed these slides, but we had these new recommendations that just happened 2 days ago in this week. So these will be adjusted a little bit. And the people 16 to 64 with high-risk medical conditions, they may actually move up into phase 1B. So if things are changing constantly, but these were the recommendations initially from the CDC going out to the states. So I will stop right now. And if you want me to answer questions now, I'm happy, or later. And we can close. I don't know if anyone wants to see any more of the slides, but if not, I'll take questions right now and I'll excerpt out of the slides, okay?
Yeah, there was a question if we'd be able to have the slides, have it put on our website. So if that's
yes, so we can make this presentation. I just have to adjust who's eligible for the vaccine for the last two slides, but we can definitely have these slides available for you to add to your website.
Okay.
And also we'll add the slides that show where you can call to make your appointment for the vaccine. It's appointment only. We can't do walk-ins, all right?
Okay, thank you, Dr. Caine. There was also, what is the infrastructure rollout for Marion County and who controls this? I know you have a lot of that on your website, but if you would like to guide them, then. So
what happens is we are allocated so many dosages that we can distribute. So we've been told that they will give us enough doses for 2,000 people for all next week. We're promised that, and then the following week, right now we know we'll get at least 1,200, but they want to look to see, can we vaccinate enough people of the 2,000 people? And so that's going to average, except for Saturday, that we are vaccinating at least about 400 people a day, okay? And related to that, and so there's a site that's by the state. The State Department of Health has a site that's called Our Shot, and I'll put it on this make some slides. We'll have that information on there. ourshot.indiana.gov. Okay, and we're going to send some flyers to NAACP. We're going to hope to get it to you before Monday, but flyers that you can send out to all of your membership, okay? And it will have where you call to make your appointment, and if you got any questions, who to call. So Crystal will get that out to you probably tomorrow, okay? And then we'll have various sites where you can get vaccinated. So all the hospitals will have sites for you to get vaccinated to, and you just decide which site you want to come to in the health department. So what it'll show on there, it'll say Marion County HD COVID-19. HD means health department, you know. And that site's going to be open for registration tomorrow morning at 9 a.m. But it is Our Shot, one word together, .in.gov. And it'll be open after 9 a.m. for you to fill the information out. And we're going to have like AARP is going to be assisting to help people who feel that they can't handle how to do the application online, especially for our seniors. We'll assist them. Marion County actually has about 970,000 people in Marion County alone. So AARP will help provide assistance, and there'll be a number where you can call if you need some assistance. We're going to have some people, like we're going to have a lot of places that have disabled people and people who can't make it to our sites. So there are going to be some mobile units out of the Vision Family Social Services that if we know those places or locations, we can make arrangements for mobile units to come in and give those vaccinations as well.
Okay. Thank you so much, Dr. Caine. If you want to hang around, we might let people ask a few questions, but we know your
No
time
problem.
is very valuable.
I'm happy to hang around. Thank you. Thanks for the
Okay.
honor.
Thank you.